We hope you enjoy this presentation of Getting Help, Depression in Adults ages 18 through 25, presented by Erica Tanney, Hiram Candland, and Jacob Dahm, Brigham Young University, Idaho students, December 4th, 2017.
Hi everyone, Jacob here. So, depression or major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Historically, there has been a negative stigma associated with mental illness. People with mental health issues were often thought to be possessed with demons or being punished by God. Today, a negative stigma continues to be associated with mental health problems. This negative stigma towards mental illness stems from a general lack of understanding. There is an ongoing effort in the United States to increase mental health awareness. Such organizations as the National Alliance on Mental Illness, or Mental Health America, and other organizations seek to increase mental health awareness. Since May of 1949, May has been known as Mental Health Awareness Month. As a result of stigma toward mental health, some people have a false perception of depression. A few examples of incorrect views of depression are: people with depression are just weak or don't have enough willpower. People with depression are emotionally unstable. People with depression are always dangerous to themselves and others. People with depression are dysfunctional or broken. People with depression are just looking for an excuse to whine or be lazy, and are often reclusive and asocial and unfriendly. So, as you can see, depression is caused by a chemical imbalance in the brain. Things that may increase the likelihood of depression are faulty mood regulation, genetic vulnerability, stressful life events, medications, or medical problems. It has been hypothesized that the primary cause of depression is an imbalance in neurotransmitters, which causes a sluggish production of neurons in the brain. Antidepressants immediately increase the production of neurotransmitters. However, they take 2 weeks to take effect. It has been theorized that the increase in neurotransmitter production may cause neuron regeneration, which helps resolve depression symptoms. MRI studies of the brain showed the hippocampus was 9 to 13% smaller in women who were depressed compared with those who were not depressed. There are several risk factors that increase the likelihood of developing depression. Some studies have shown that in many cases depression runs in the family. There have been studies shown that twins, often if one twin has depression, the other does too. Personality traits such as pessimism, poor self-esteem, and easily overwhelmed by stress can make one more susceptible towards depression. Other risk factors that increase the likelihood of developing depression are changes in one's physical condition, such as chronic pain or chronic disease, cancer, or a sedentary lifestyle. Environmental factors that may increase the likelihood of developing depression are frequent exposures to violence, neglect or abuse, or poverty. So here's a few statistics on depression. In a 12-month period, 10.6% of adults ages 18 to 25 had depression. Depression affects 1 out of every 15 adults in any given year, which is about 6.7% of all adults. 1 out of 6 adults, or 16.6%, experience depression at least once in their lives. Depression most often first presents in late teens to mid-20s. Women are twice as likely to develop depression than men. and a staggering 1/3 of women will experience a major depressive episode in their lives.
Hi everyone, this is Erica. So, what is depression like? Well, for many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities, such as work, school, social activities, and relationships with others. Other people may feel generally miserable or unhappy without knowing why. They may not recognize or acknowledge that they're depressed. They may not be aware of the signs and symptoms of depression, so they may think their feelings are normal. Hopefully the slides in this presentation will help with that. So here's a little bit more information about the experience of depression. Men tend to struggle more with depression-related stigma because they're afraid others will see depression as a sign of weakness. They may try to fight depression on their own instead of seeking help. All too often, people feel ashamed about their depression and mistakenly believe they should be able to overcome it with willpower alone. That can be a very dangerous choice because depression rarely gets better without help and is likely to get worse. Here are some other symptoms of depression that you may recognize in yourself. Feeling unexplained sadness, emptiness, hopelessness, or crying for no apparent reason. Feeling excessively angry, frustrated, or irritable about insignificant things or minor problems. No interest in activities that usually you would love, or no more excitement or pleasure in hobbies, sports, or sex. Exhaustion, or sleeping too much. Some people report just feeling tired all the time. No energy or stamina for even simple, easy tasks. Decreased appetite or weight loss, or increased appetite and weight gain. Feeling restless, anxious, or agitated for no particular reason. It's important to know that unexplained weight loss may be a sign of a very serious medical condition. So if you are experiencing unexplained weight loss, it's important to be seen by your primary care physician, nurse practitioner, etc. The experience of depression is unique to each individual, but here are some additional symptoms that are common with depression. Feeling like everything you do is slowed, the way you move, think, and speak. Headaches, backaches, and stomach aches that don't seem to have a physical cause. You may feel guilty, worthless, constantly thinking about past failures, or blaming yourself for things beyond your control. You may have difficulty concentrating, thinking clearly, making decisions, and remembering things. Finally, the most serious being habitual thoughts of death, suicidal thoughts, or suicidal actions. It is our hope that this presentation will help young adults to recognize symptoms of depression in themselves, but also it's important to recognize signs of depression in others. Someone who is depressed will be verbalizing negativity, criticism, and have unusual pessimism about others' good ideas or plans. A loss of confidence in oneself and optimism about the future is also a sign of depression. Depressed people feel poorly about themselves and their future. It's also important to note someone who is depressed may come across as if they're deliberately trying to be difficult all the time, but that's not the case. Here are some other signs of depression to be aware of. Someone who is depressed may seem unusually irritable or more easily provoked than usual. Generally, this will go on for a minimum of 2 weeks or more. They may have stopped participating in or don't seem to enjoy healthy activities that they used to love. They seem to be tired or sleeping much more than usual or necessary, or they're often awake when they normally would be sleeping. They may have lost weight and don't seem to be eating, or have gained weight and appear to be eating all the time. This part of the presentation is very important. Please pay attention to warning signs. Often when someone is using suicidal speech, they may seem like they aren't serious, but take it seriously. Some examples, and this is not an exhaustive list, but these are just a few of the examples of some suicidal comments that someone might make when they're depressed. I don't care if I live or die, or why does it matter, or nothing matters. Sometimes I feel like driving the car off the road, or there's no reason for me to live. I'm useless. Finally, another common one is, sometimes I just think about ending it all. Please don't believe that someone who is depressed can just get over it, that they can tough it out, that they can just brave their way through it. It's an unrealistic, ignorant view of mental illness, which puts many college-age adults at dangerous risk for complications associated with untreated depression. Please don't believe that you or someone you know is just being unreasonably difficult, lazy, or negative for no reason. Don't just assume that everything will be fine, or that someone just needs to get over it, or that you just need to get over it. That's simply not true. Sometimes we all need help, and refusing to get help isn't brave, it isn't tough. What's really brave is seeking for appropriate help when you have depression, despite what ignorant people might believe. Some common consequences of ignoring depression include developing anxiety, panic disorders, or social phobias. You may gain excess weight, which can lead to heart disease and diabetes. Some people may experience physical pain or physical illness. Some may turn to the use of drugs and alcohol to cope with feelings of depression, which leads to substance abuse. Ignoring symptoms of depression and refusing to get appropriate help can result in family conflicts, relationship difficulties, and damaged relationships. Someone with depression may experience work or school problems, job loss, poor grades, or even expulsion from school if they choose to ignore the signs of depression. They may experience social isolation, which can further contribute to depression and loneliness. They may experience an increased likelihood of harmful behaviors, including smoking, poor diet, lack of exercise, poor sleep habits, and non-compliance with medical treatment recommendations. Non-compliance just means disregarding or ignoring recommended treatments or doctor's orders. Other serious consequences of untreated depression include a poorer quality of life for oneself and your loved ones, homelessness due to job loss and inability to cope, self-mutilation such as cutting, premature death from a medical condition, some that may be associated with changes in the body due to untreated depression, suicidal feelings, suicide attempts, or suicide.
Thanks, Erica and Jake. This is Hiram. As we've been talking about, depression is a debilitating and pervasive condition that can affect all aspects of a person's life. The good news about it, though, is that there are a lot of different treatment options for depression. Some of the treatment options include general support, medication, non-medical therapies, and alternative therapies. The first form of treatment that I want to talk about is general support from family and friends or close loved ones. While this is an informal form of treatment, it has been shown that People with depression who receive support from their family and friends report having greater life satisfaction. Family and friends can provide emotional support, they can provide information, and they can provide companionship that may bolster emotional stability. The next form of treatment that I want to talk about is medication. There are a lot of different medications available to help treat depression, and not all of them are antidepressants, but here we are going to talk about several different classes of antidepressant. These will include selective serotonin reuptake inhibitors, or SSRIs, serotonin and norepinephrine reuptake inhibitors, or SNRIs, atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors, or MAOIs. The first class of antidepressant that I want to talk about is selective serotonin reuptake inhibitors, or SSRIs. Serotonin is a neurotransmitter that relays information between brain cells. The problem for some people with depression is that serotonin gets reabsorbed and is not available to relay information. SSRIs, like the name implies, blocks the reabsorption of serotonin, allowing more neurotransmitter to be available to elevate mood. Some common SSRIs you might have heard of are Prozac, Paxil, and Zoloft. Some of the other classes of antidepressant are serotonin and norepinephrine reuptake inhibitors. Norepinephrine is another neurotransmitter. This class of medication works very similar to the SSRIs, but it works on serotonin and norepinephrine. Some of the common SNRIs that you may have heard of are Cymbalta and Effexor. Atypical antidepressants are a class of antidepressant that affect the levels of one or more neurotransmitters. And these medications do not neatly fit into any of the other classes of antidepressant, hence the name atypical antidepressants. Some of those common atypical antidepressants are Wellbutrin, Remeron, or Trazodone. Now, the interesting thing about atypical antidepressants is that they seem to have different indications other than depression. Wellbutrin was originally developed as a smoking cessation aid, and both Remeron and Trazodone, while they are antidepressants, they are primarily used as sleep aids. Tricyclic antidepressants increase the serotonin and norepinephrine levels and block the action of acetylcholine in the brain. This class of antidepressant tends to cause a lot more side effects than the other classes, so it is generally used less frequently. Monoamine oxidase inhibitors, the way they work is that monoamine oxidase removes neurotransmitters from the brain. So MAOIs prevent the monoamine oxidase from removing those neurotransmitters, and it allows more neurotransmitter to be available to elevate mood. For good or bad, everybody is different and unique, and this goes for their response to medication as well. An antidepressant that may work wonderfully for one person may not work at all for another person, or vice versa. Or maybe the side effects from a medication might be so severe for one person that it just isn't worth taking. So choosing the right antidepressant may require some trial and error and maybe a lot of patience. Complementary and alternative therapies are frequently used to treat depression. In fact, depression is one of the leading reasons why people use alternative medications and therapies. Some of these complementary therapies can range from simple informal self-care practices like exercise therapy and bibliotherapy, which is really just a fancy word for reading, to dietary changes. It can move on to some more formal talk psychotherapy like cognitive behavioral therapy, and can even extend into some more extreme treatments like electroconvulsive therapy. CBT, or cognitive behavioral therapy, is a structured talk psychotherapy led by a trained therapist. CBT helps you become aware of inaccurate or negative thinking so that you can view challenging situations more clearly and respond to them in a more effective way. What this means is that you are able to develop and use coping skills to confront your life challenges. ECT, or electroconvulsive therapy, is where a temporary seizure is induced intentionally under general anesthesia. ECT disrupts electrical signals in the brain and can change brain chemistry to alleviate some mental illnesses, including depression. I think a lot of people have a very negative view of ECT because they may have seen One Flew Over the Cuckoo's Nest or some other video of a patient having extreme convulsions and maybe in some distress during a treatment, but that's really not how it is anymore. But ECT does have some pretty significant side effects, including short-term memory loss. So it's usually a treatment that is chosen only after other therapies have failed. As indicated earlier, one essential depression help is the support of family, friends, or other loved ones. Whether for yourself or for somebody else, it is crucial to recognize the symptoms of depression. If you identify some of the symptoms of depression that we talked about earlier in a family member, friend, or loved one, how can you help? So first, don't be afraid to talk to this person about it. Depression and other forms of mental illness are not something to be embarrassed about and should not be ignored. Normalizing depression with straightforward talk can help somebody feel less stigmatized and willing to open up about their experiences. And as we talked about before, there are a lot of different kinds of treatment options. One way that you can help a person who's experiencing depression is by encouraging them to seek out treatment. These treatment options can range from very informal to formal healthcare professionals or structured treatment. Something to be noted is that these treatment options are complementary, so a combination of different treatment modalities can offer balance and can be very effective. Regardless of the treatment options that you or they choose, people with depression should be reminded of the many groups that advocate for and support them. One of these advocacy groups is the National Alliance on Mental Illness. NAMI is a trusted national resource for depression and other mental illnesses. NAMI.org provides education about various mental illnesses, treatments, and blogs of personal experiences. It provides links to support groups, awareness groups, and offers opportunities to volunteer. Your state has a network of providers who are contracted to either provide or coordinate comprehensive mental health services, including psychiatry, counseling, pharmaceuticals, and case management. In Arizona, referral to these services can be accessed through the Crisis Response Network and your state has a similar resource. Contacting these resources can help a person be referred to the mental health services that they need. There's a growing body of research and increasing interest from school administrators acknowledging the need for mental health services for their students. Universities and colleges have on-campus counseling services and other resources to support their students in dealing with the stresses of college and life development. One example of this is Arizona State University's ASU Counseling Services.